into one of the top 3 items in the kit as soon as people get familiar with it. The great thing about the kit, they're completely in English, completely in Spanish, so all of these resources are translated for the end user's use, and they're done at a reading level that most people can comprehend. And even if you have pre-literate parents, we recommend you identify a partner with them to go over the kit contents. So let's take a little bit of a deeper dive. And we'll talk with Linda about working together and training in a minute.
Okay, so there's a lot of ways that you can use the kits in your programs. And many of you on the call have probably already seen the kit or maybe even incorporated in some of the things you do. And the 2 basic ways would be doing training in under a minute when you don't really have a lot of time with someone. Some of the research that I did on the parent kit showed that if a parent or caregiver is oriented to the kit, they are much more likely to use the kit, to learn from the kit, and to make positive changes from the kit than if they're just handed a kit and they don't really know what it's about. So training in under a minute is very easy. You just take the kit out of the bag, the contents out, show the parent or caregiver what's in the kit, briefly describe the different materials just like Vicki did, and then pick one of the materials and talk to the parent about something that's relevant for them. And in this case, about oral health, you might talk to a pregnant woman about the importance of seeing a dentist during pregnancy and having good oral health care. Parent of a toddler, you might talk about the importance of getting to a dentist before the child is 1 year old. Something like that. Just point to something in one of the contents that you think is useful. The 2 contents that have the oral health information are the California Parent Guide and the What to Do When Your Child Gets Sick book. And together, these 2 resources cover most of the important topics that relate to oral health, most of the messages that you want to give out. So you tell the parent at this point that the guide is, the kit is really important to use. Take it home and use these resources, and also encourage them to have other family members like their partner, other people that come in contact with a child to use it. So this kind of 3-step process can be done in under a minute. If you have more time, then you can do a training, say in a class setting, and Vicki can go into some of the ways that trainings can be done. I would overall just say, think of the kit as a resource that you can drop into most anything you do when you're working with people who care for children 0 to 5.
Terrific. So we're going to give you a gift and post on your Dropbox the Kit for New Parents Partner Resource Packet. This was created by First 5 Monterey County, and we've worked for years on it, and we keep tweaking it. And this year we feel like it's a robust enough publication to share it with the entire state of California. And I just want to reiterate, when you're training people, the bottom line here with First 5 is we want to have the 5 protective factors in place. So what the kit does so beautifully is it creates parent resilience. It gives them the tools to eliminate stress from parenting, because if you know you have a support system, you can constructively cope and bounce back from all types of challenges. And knowing about parenting and child development is huge. And the kit, again, contains all those valuable resources. And for dental oral health information, What to Do When Your Child Gets Sick and the California Parents Guide are really robust publications for parents. The social and emotional competence of children, we want the child to be able to act positively with others and self-regulate and effectively communicate his or her emotions. And that's also, you know, part of going to the dentist. We want them to be socially and emotionally ready to do that. And so we want to offer them that safe environment and bring it up in a healthy way to the child so they're excited about going to the dentist and dentist care. And then social connections, we want that child to be surrounded with love and healthy, thriving families and their network and their extended family and their friends. So we also recommend that we give the kit not only to the parents, but if the parents have a grandparent who primarily watches the child, then give them 2 kits. Let them have one for the mom and one for the grandma and explain the oral health to the whole family. And then, of course, concrete support in times of need, shelter, food, clothing. And what First 5 does so beautifully is they help connect families to those resources. So we have that foundation of the protective factors. And what we want you to do is order the kits so you can use them into training. So first, you're going to order your kits from your local First 5 if they have that person in place. Some First 5s will refer you back to the state website. And if you're having problems with ordering the kits, I'm your next line of defense. So here's my phone number, here's my email, and I simply need your address, your phone number, your email, the number of English kits, the number of Spanish kits, and I will place your order directly with the state, and you'll get them in 10 working days. And again, they're free. Doing a deeper dive into training, the resource guide that we're sharing with you, is very exciting. We've taken the 2 books, Exploring the California Parents Guide and the What to Do When Your Child Gets Sick Guide, and we've actually created training outlines for you. So we'll have this little cardboard box here on all the training outlines, and it'll tell you exactly which supplies you need, Post-it notes, flip chart, markers. It'll give you a little lecturette about what to say to the parents, and then the activity instructions. So for example, for the California Parent Guide, we're recommending that they work in pairs and write what are the most amazing things that they're learning in the dental section of the California Parent Guide. And then you put those Post-it notes up on the wall and process the information, find out if they have any more questions, and then always do some processing questions at the end, like, remember, First 5 is here to help you, and our dental clinic or location is here to help you, and who else in your family needs to know this information about dental care. So again, if we're talking about things like brushing a child's teeth and the parent isn't there during teeth brushing time, all those care providers should know how to correctly assist the child with brushing their teeth. So that's one of the activities. And the other activity comes from the What to Do When Your Child Gets Sick. So what we're recommending is that you hang 2 signs on opposite walls, one with the word home, the other with the word doctor or dentist. And the trainer is going to read statements describing baby situations that may require dental knowledge. So we gave you some sample questions here. We took it directly out of the guide. So here's where we're going to do a little interactive. So let's pretend that this side of the screen is stay at home, and this side of the screen is go to the dentist. So what you're going to do is go up to where it says annotate, and you can check a stamp. So my toddler has white spots on their teeth. Do I stay at home, or do I go to the dentist? So if, Katie, you can let people take their votes. So again, you're going up to the top of your screen and you're choosing annotate. Yay! So this is go to the dentist and this is stay at home. Well, it looks like go to the dentist is leading the pack. So this is exciting because when you're interacting with parents, they just don't want to sit the whole time and listen to lecturettes. or even your clients, get them excited about these resources. So doing activities like that gets everybody out of their chair and moving back and forth. So it can just be a fun, even opener for any of your meetings, just to refresh your knowledge. Okay, let's clear this one, but I think the big winner is go to the dentist. And yes, that is correct, because white spots on the teeth can be a sign of decay. So let's do this again. My child is drooling excessively. Do I want to stay at home on the right, or do I want to go to the dentist? And let's see those votes. Stay at home for drooling or go to the dentist? And it looks like we have some votes for stay at home. We had a vote for go to the dentist. And I always tell people there's no wrong or right answer. There's no judgment here. What we're doing is just increasing our knowledge, and what a fun way to do it. And you get to get up and stretch. So you can, as you can see, it's really easy. Any of the information from any of the guide, the California Parents Guide, or what to do when your child gets sick, you can turn them into, do you stay at home? Do you go to the dentist? Or correct ways, the topic could be correct ways to brush your baby's teeth. Do you use a full-size adult brush, or do you use a piece of gauze or your finger? So you can just spin anything into a question. Yay, we got some great votes here. So it looks like you're going to stay at home, and that is the true and correct answer, because the child is teething, so that's why they're drooling excessively. But the great thing about the kit for new parents and the information contained in that is a lot of people, especially new parents, will panic. And so like, for example, a child swallowed a bead, and they're like, oh, I have to go to the emergency room. And they go to the emergency room, and they say, guess what? You're going to watch their poop for a couple days. So now you've spent $600 on an emergency medical visit. That was unnecessary. So this is where it can really provide such a solid foundation for our parents. Great. Thanks for participating. Oh, I've still got my stamp going. Let's see. Format, spotlight. Nothing clear. Okay. So that's the training resources that we wanted to share with you this morning. And Katie, did you want to talk about how to integrate the kits into the local oral health program?
Vicki?
Yeah, thank you, Vicki, for that fun presentation. Yeah. Linda?
Yes, I just wanted to
Hi.
add something that the kits can also be, I think, Vicki, you mentioned, customized at the county level. So let's say you have some great resources you would like to give to parents and caregivers. You can go to your first 5 and say, I'd really like you to get these put in the kit. So everywhere the kit goes in our county, it'll have these oral health resources. And so there's a limit on what can be customized in each county's kit. But if they agree to put in some of your oral health resources, that would be fantastic. Not only for the partner groups that you work with directly, but for everybody that first 5 gets the kit to in that county.
Great. Thank you for mentioning that. So every county is given the opportunity to have what we call 3 touches, but some counties can get really creative about it. So when we send our customized items to the state, it's only 3 items to drop into every kit. So like, for example, our local county, we put in a beach ball with the Pandora radio station link. So that's 1 touch. And then we took the postpartum depression information, the Early Childhood Collaboratives flyer, and the United Way flyer, and bundled it into a Ziploc bag. So we actually added a lot more stuff to the kit than 3 touches. So if you have a flyer that you'd like to include and they say, oh no, we already got our 3 touches, just suggest to them, hey, you know, a Ziploc bag can contain a lot of different resources and brochures. And then we added the book Growing Vegetable Soup. So that's our 3 touches. I know a lot of counties already have great dental resources like fingertip toothbrushes and fluoride toothpaste. So if you have access to hook up your local first 5 with those resources, please do so. I know I would love that gift if somebody came to me and said, hey, I can hook you up with free dental resources. I'd be all over that and figure out how to repackage my 3 items to include that. So oral health messages. You want to just take a deeper dive into the books. The California Parents Guide is, like we said, one of the rock resources for oral health information. And again, it's in English and in Spanish. And coming soon in September of 2019, it'll also be available in the Asian languages. What to do when your child gets sick is also in English and Spanish, and coming soon in the fall of 2019, the Asian languages. So they're very robust, and they're written and audited by just a wide variety of audiences to make sure that the language level is understandable and that all of the information is true and correct. And so having said that, for example, in the California Parents Guide, we have information about prenatal care for mom, because we all know it's important. And you're going to see right here, oral health is important. So it's recommending to that prenatal mom to take extra care of your gums and teeth when you're pregnant, and that the awareness that gum disease can cause your baby to be born too early and too small. And I believe a lot of people aren't aware of that. And so encouraging them to see the dentist and to continue to brush and floss daily. And again, all of this information that are in all of the guides, Linda and her team spent an enormous amount of time verifying every single word that's written to contain the most current and relevant information for parents. I do want to just, because it's near and dear to my heart outside of oral health care, that throughout the guides, talk, read, sing is really emphasized, because we know that up to 80% of a baby's brain develops in the first 3 years. So we want to encourage all of our parents, beyond good dental care, talk, read, sing to your baby, your toddler, your 5-year-old as much as possible. Their brains are growing at an incredible rate. For first teeth information, the California Parents Guide has information on what to do when your baby gets their first teeth, that they come in around 6 months of age, and brushing your baby's teeth twice a day with a smear of fluoride toothpaste, and making sure that by their first birthday they go and have their first dental checkup visit. Both books have great dental care resources contained in the books, and as you can see, the California Dental Association and how to find a dentist are prominently featured, as well as information on the care for the baby's teeth and teething. A hot topic for all parents. Hot topic for all parents is the knowledge of other resources that are out there for them. And we just want to emphasize that the ADA site, which is right here, so when you download this presentation, you'll have access to it, has just a wealth of information on cleaning the child's teeth. And I love this diagram. It's the baby teeth eruption chart, so parents know which teeth to expect when, what to expect on your first dental visit, and then just ways to prevent tooth decay, which really, contrary to popular belief, doesn't include hot Cheetos and soda all the time. So that's just some bullet points on that. And then dental information. And here I'm going to switch to some of the information in the What to Do When Your Child Gets Sick book. There's a robust chapter on teething and what it looks like, what you can do at home. And again, please go to the ADA site. They have a wealth of resources, including videos that are just amazing. And what I really love about these videos is they're short, they're to the point, they really are presented well to people. And then if you go down here where it says on the video, this little cog right here, if you're working with somebody who speaks another language, it's very easy. Oops, when you're not already in the video. But right here on the cog, you can switch to whatever language you wish. There's like 32 languages, I believe, that you can switch to, including the Asian languages, Spanish and English. But how great is this, that they tell you, okay, this is where the teeth are going to come in, and look at, you get a sample of a fussy baby, so you're not the only mom on the planet or dad on the planet that has a fussy baby. And then it also lets you know what to be worried about, and that sore gums are common, And again, gently rubbing your baby's gum with a clean finger, a cool teething ring. But what I also love about all these videos is they reflect the diversity of the state of California, so parents can really connect with these videos. And to let people know that the adult teeth are going to start in by age 6, and that's the other thing we'd like to clear up about the kit for new parents is they're not only for babies. The kit for new parents are written from 0 to 5, and the What to Do When Your Child Gets Sick book actually goes up to age 8. So we want to get these resources in the hands of every parent in the state, because as they go throughout their child's development, they'll have resources to point to. And again, there's a chapter on toothaches and what to do, and that fluoride fights cavities, and you want to teach your child to brush their teeth at 2 years old, and help your child brush their teeth until they're 5 years old, and the emphasis again on fluoride toothpaste and going to the dentist. And then, of course, we have the emphasis on checkups in both books as well. And see, the Kit for New Parents, here's a great example in the California Parent Guide. That's not a baby. That's a 4 or 5-year-old girl who they're talking about checkups for. So continue to use this resource with your parents as their children grow and develop. So we have an activity for you. We want to have you once again go to the annotate bar, and you can type in what are some key points about dental care that you want to imprint on your end user's brain. So whether that's a client or that's a partner that you want to increase their dental knowledge, what are some key things you want to imprint on that brain? And Katie, are you there?
Yeah, I'm here.
Oh, there you go. Okay. Yay.
Brush twice a day. Age of first checkup.
And if somebody puts something that you agree with, you can always just put a heart next to it, or a squiggle, or a check mark. Any other learnings you've had that you want to imprint? Cavities are contagious. That's great. So this is the great thing too, if you want to use this as a platform for your own PowerPoint training or webinar, please do so. I give everybody permission to swipe whatever they want off of this presentation and create their own presentation. It's a great way to interact online.
Yeah, and this is also a great way to interact with your advisory committees. And as you guys are coming together and you're going through oral health literacy campaigns, this is one of them that you guys can consider using for your local oral health programs. I mean, as you can tell from the presentation today and what Vicki and Linda have shared, this has been vetted multiple times. It's relevant. It's supported by the Department of the Office of Oral Health. And we really want to give you like those tools that you can go out and you can start training, no matter how much time that you have. And these kits are free. And they're in English and Spanish, and also they're coming out in Asian languages later this year.
Mm-hmm. So I think prevention is the key. Great importance of fluoride. Cavities are contagious, got a check mark.
Yeah, and you can see like there's a lot of messages that you can focus on, and that really comes from the guiding principles that you have as a local oral health program of, you know, what sets the tone, what are you focusing on, what is your target population? And as you guys incorporate your oral health messaging into your work plans, Objective 9 is all about coordinating outreach programs to implement education, health literacy campaigns, and oral health into primary care. So this is a great example of, you know, where you can start, how this is doable, and work on those early stages of communication. Like, how do you learn about the kit? Like the webinar today is going to be available and you can share it. How do you order? You can order through your local First 5. You can also order through Vicki. Who and how to engage your community. Some ideas for stakeholders could be your First Five, WIC, CHDP, Black Infant Child, home visiting, primary care settings. Again, there's no limit on how many kits that you can order. We're really looking to have this be a staple in the community and to get it out there. And through your efforts of what you're doing at the local level, we really want to help you and encourage you to bring together those stakeholders that are promoting oral health and all health and wellness for children in the community.
Mm-hmm. And Katie, if I can add to that, a lot of people say, well, what if somebody else is giving out the kit? Some people might say, oh, I already have that, but I can tell you from looking at the numbers for every county, very, very few counties have saturation. Like LA County could give out 200,000 kits a year, and they're only giving out 40,000 for the whole county. So you have a lot of opportunity here to get the kits out. And again, remember, it's for 0 to 5, and that it's not just for the moms and dads, it's for any care provider that is part of that social circle of love for that child.
Yeah, absolutely. There's plenty of kits. There's no shortage. We really do want them to become a staple in the community. And going to the chat box, thank you for writing in. We have from Lake County, they are putting together oral health kits to go with the new parent guide that have oral health brochure, adult toothbrushes, infant toothbrushes, and fluoride toothpaste in a timer.
Wow. That's terrific.
That's great.
By
Very
the way,
creative.
this is information. This is Linda again. This is information that is going to be very useful to get to the Office of Oral Health. So if you are customizing your materials, we would all like to hear what you're doing. And Katie, you probably have some suggestions, being the coordinator at COTAC, about how people can maybe let you know what they're doing.
Yeah, absolutely. Also, Kathy from El Dorado County, they're using the Brush Book Bed app. And then Heidi from Placer, we have added to the kits our local dental resource list, the Brush Book Bed handout, a finger brush and dental supply bag for the parent, brush, paste, and floss. And yeah, this is a great way that we can work together with the counties, the Office of Oral Health, with Linda and all your experience, and Vicki, of gathering what's out there, what you guys are using, and sharing those success stories. So next, we're going to go ahead and we're going to open up the call, and Sherry's going to share what she's doing in Stanislaus County. So Sherry, if you want to go ahead and unmute yourself, and I can try to unmute you here. We'll try to get you on the line to share what you're doing. Sherry, are you able to come off mute? Maybe not. I could unmute everyone, but that.
I think you can do Control-Shift-A. Put down those 3. Or is it Command-Shift-A? I forget.
Yeah, I just don't have the icon here to unmute Sherry. That's okay. We'll go ahead and open the lines. There might be a little bit of background noise, and then we'll see if Sherry can share. One moment. All right. Hi everyone. Everyone's been unmuted. Hi, Sherry.
Can you guys hear me now?
Yeah, we can hear you. Sorry about that.
I feel like an old Sprint commercial. Can you hear me now? Good, almost afternoon, everybody. I was excited to hear about this webinar, and I was emailing Katie and had let her know we are fortunate to have really strong partnership with our local First Five, and that's been long-standing. But I'm excited for today's webinar and the information too, to engage other partners. But we are working with our WIC program as well, to get them to offer not only the kits to new mommies in the 0 to 5 population, but also incorporating oral health education into their WIC required classes. So that's how we're going to kind of start rolling out the kits when they come to their orientation classes and they're receiving the oral health education along with their nutrition education. And then we're also going to be putting in additional oral health goodies and oral health hygiene items into the kits. But really how we started that partnership with our local WIC program was on Halloween. We engaged them to offer toothbrushes to hand out rather than candy. So, because they have a really hard time finding stuff besides stickers and things like that to hand out on Halloween to the kids, because they definitely don't want to
this is Roberto
contradictive to their message. So that was how we additionally started our partnership with WIC. We're also going to be working with our maternal adolescent child health program, 2 specific programs within that of our public health division, which is our Healthy Birth Outcomes program. And that's for expectant moms, and then they're able to stay within the support groups. So we contract with local family resource centers and parent resource centers to offer ongoing classes and a peer-to-peer kind of support group, and it provides facilitation. So we'll be rolling out the kits with that program, as well as our Adolescent Family Life program, and that is for parenting, I believe, foster teens to help the possibility of a second teen birth. So that's really the 3 we're working with right now in 2020 and moving forward. And then we're also starting conversations and dialogues, and hopefully, although it's a little more difficult to get into, our local hospitals, their labor and delivery department. And then one way we're, if we're not able to access, which we're trying, that through the labor and delivery, we're going to start with perhaps their birthing classes that parents are signing up for and incorporating the kits there. So that's about it for us. And again, we're increasing the oral health information within the kits and including some oral health hygiene items as well.
Sherry, these are great examples of how you can integrate the kits.
Katie, and if I can piggyback on what Sherry was saying, like she sounds like we're trying to get into the hospitals. I had a real hard time getting into the hospitals, but what I finally found was the magic bullet is to work with the volunteer auxiliary, because they're the people who go around with their carts and pass out gifts to the new moms. So they were more than happy to distribute and go over the kit contents with the new moms. So if you worked with them, they might emphasize the oral health information. And then remember the kits, if you put them with ribbon on these envelopes, they make a great gift. So for dental clinics, it's like, here's our gift to you, new patient. We're so glad you're here, and we use these tools and resources. If you open up the envelope and have the bag, you can drop in your own dental flyers that you use locally and your local resources. So if you're not able to customize the kit, you can add your own items to the kit. And then remember, if you ever do any like dental health fairs in the community, you have a booth out on Founders Day or something like that, you can order kits from 0 to 500, and that's 500 English, 500 Spanish. So remember that that's a great giveaway at a booth, and it will attract lots of people to your booth, especially since they have the reusable bag. And as you go around different festivals, people love to have a great reusable bag. And Katie?
Yes. Yeah, that's a great way to bring out the kits, as going out to your providers and reaching out to maybe your dental offices, FQHCs, even primary care settings, just really having that accessible and making it more of a gift, something fun that they have. And you touched on a really great point, Vicki, is like kind of who do you bring into the planning stages of implementing the kits? it's kind of who is like working directly with the population that can help. And what you mentioned with the hospital is a really great way to kind of get to the people who are going directly to the patients. Has anyone worked with WIC centers or with home visiting and had a similar experience? Or Vicki, have you worked with WICs before and been able to kind of help with coaching them on how to use these kits, how to train their teams?
Yes, absolutely. Because WICs, and the other thing to do is look at the glossary, because it'll tell you by agency how many references there are. So the way I got into the WIC world was there's like 8 to 10 pages on WIC information. So I'm like, not only does it have this information, but it also has information about you. So it's a great resource to show. And I think the California Parents Guide did that so beautifully. They listed all the pages that reference all the different agencies and people with expert knowledge on different topics. The other agencies I work with, there's no limits really. I work with Easter Seals. They're always looking for things for their special needs families to give away. I work with, of course, all the dental clinics. I work with clinics in addition to hospitals, the local clinics for low-income families. They're love to have a free gift. And the kit's a $75 value. So you say, here's our free kit, and it has free shipping. And trust me, when you reach out to your partners, you're going to have that skeptical look in their eye, like, where's the catch? Do I get billed later? What's going to happen? And the thing to emphasize, too, is if storage is a reality for you, you can order the kits in small quantities. So they come 5 in a box again. So you can have just 1 box of 5 English, 5 Spanish, set them on the shelf, distribute those, and then reorder. Just be aware it takes up to 10 working days for the reorder. If you have a big event and you order 500, be aware that you're going to get a pallet shrink wrapped with hundreds of kits landing at your door, so plan accordingly. But the great thing is the quantity, not too little, not too big, it's up to you. And the kits can just be used with such a variety of partners. I also use them with probation. I use them with the alt ed schools that have pregnant teen moms. I use them with parenting groups, parents as teachers. They love the kits, and they actually have woven in our training design. So not just the dental designs I shared with you today, but there's designs for a variety of topics in that packet that we're going to share with you.
Yeah, and as a reminder, what Linda was sharing earlier is that when you're introducing the kit, if you have a short period of time, if you're at a health fair and there's a lot of people around, if you can have a kit open and just show them what's in it, they're much more likely to use it. So just kind of tailoring your training and your approach when you go out and you're working with the community. And if it's going to be 1 minute, if it's going to be 20 minutes, having the time to do it. And Katie, if I can add to that, if you're going to be at a health fair, take the time to crack open a bunch of the envelopes. You just cut them open with a pair of scissors. And then I found that there's these little crates that match the color of the envelopes at the dollar store. So they're fabric crates, and they hold 10 kits a piece, and they cost me $1. And then I just line up the reusable shopping bags in the crates with the English side facing out for the English and the Spanish facing out for the Spanish, so I don't get them confused. But believe me, your booth will catch on fire at a local festival, because once people see the bags walking around, they're going to be like heat-seeking missiles trying to find your bags. Yeah.
This is Linda. I was going to mention that in many communities, if you're trying to work with a hospital, often there's a community benefit program in the hospital, and they are looking for good ideas that don't cost them money. And so if you can work with them to get kits out, they will be an excellent partner there.
Yeah.
Because it was 1723, it went to
Do we have any other success stories on the line of of examples of counties using the kits?
Katie, can you hear me? This is Heidi in Placer County.
Yeah, we can hear you.
Okay. Hi, and hi, Vicki. I don't know if you remember me, but I was the one that placed the order for 500 English and 500 Spanish. And Vicki calling me and contacting me to make sure I knew that pallets would be arriving. We have introduced them to WIC. Our WIC here in Placer hadn't been giving out the older first 5 kits. And so they are starting to do that now. So I've inserted like I said, the AAP's brush book bed handout and our local dental resources, as well as the finger brush for the infant and a parent kit, a dental kit. So those are going over really well. I've introduced those to our foster care nurses. So they, along with training, because I'm doing the, excuse me, the Objective 9. So along with these bags, everyone needs to have some oral health training so that everyone's, putting out the same oral health messages throughout the county. And then also our PHNs who go on home visits, they're utilizing those, and our home visitors. So we have many promotoras and health educators doing home visits. And so as they're getting the oral health training, they're also getting these bags. So they love giveaways, because families love giveaways. So
we love giveaways. Anything free, it has, that has a puppy book, and if you customize it, it's a great resource and or gift.
Exactly. So yeah, so far so good.
Yay.
Great. So it sounds like you had enough room for the pallet that came in.
Yeah, I have a lot of space, which is great. So it's going very well. People love them.
Good, good. And you touched again on Objective 9, and this is a great way to introduce a health literacy campaign, engage your community. And you had mentioned home visiting. That's something that we've had a lot of questions on. Any other feedback on home visiting and using these kits?
I can add something here. This is Linda. I have done a fair amount of training and research about the impact of home visiting and the use of the kits, and it's very positive. One of the things that we hear from the nurses or social workers that go on home visits is that often the parents or caregivers might be a little nervous about having someone visit. And when you bring a gift with you, I love Vicki's idea about putting a ribbon in the bag. That makes it a wonderful gift. It's a wonderful entree to someone coming. I'm bringing you a free gift. So it just opens up things, especially for parents who are a little nervous about it. And it provides the home visitor with some excellent resources to use.
Yeah, that's a great introduction to meeting someone for the first time. It's like you're going to someone's house and you bring something to eat. So it's nice to come with a gift. And then have the book there. So if you're kind of new at talking about oral health, and this may be one of your first times, it's wonderful to have the parent guide book available, that you can open it, you can go to that page, and then it has an illustration as well as key messaging that you can see on the screen right here. So it has all the key points for you. So this leaves a lot more room for you to go in, have messaging that then you can leave with them, and they can go back and they can reference in their own language. So it's a great hands-on tool that you can introduce to them. And then next time you see them, you can follow up to see if they have any questions. Great.
So, were there any other questions from anyone?
Well, thank you. Thank you so much, Vicki and Linda, for being on the call. And thank you to all the local oral health programs. Thank you. We hope you found this webinar enriching and fun, and a resource and a tool that you can use as you guys are developing training programs ordering the Parent Guide Kit, and then using it in your communities. And our goal is to make this more of a staple so it gets out there, and it's a resource that gives you a lot of tools and can be a gift. So thank you everyone so much for being on the call, and please, if you have any questions, please let me know. Thank you everyone. Have a great day.
Great. Thank you, everyone.
Thank you.